I'm really pleased to introduce Mike Edmond. He is a longtime friend and a professor of medicine at the University of Iowa and the chief medical officer there, and has a long history of working as a hospital epidemiologist. And I thought with this abrupt and frightening onset of COVID-19 that I wanted to ask him his perspective from the hospital. And the first question I wanted to ask you, Mike, is we've been reading a lot, and I've talked about it in the course, the issue of asymptomatic and minimally symptomatic individuals who are infected and carrying COVID-19. What percentage of patients do you think fall into that category?
I don't think I could give you a percentage, but I guess what I would say is that I think there's a substantial fraction of people that are not very ill and may have no symptoms at all. And I think those are probably younger people for the most part, and particularly kids who seem not to get very sick with this virus at all.
Okay, and so that the thing that directly follows from this, and actually we're coming to grips in our hospital, is who should wear PPE and for what percentage of time should they be wearing personal protective devices or equipment.
So I guess let me just back up a little bit and just say how we are making decisions about PPE. Basically we do it the way we always do when we look at any pathogen. And that is, how is that pathogen transmitted? So we know for this particular virus, in order for you to become infected, it has to reach your eyes, your nose, or your mouth. Those are the three key places. And there's two ways that can happen. So one is when a person is infected with COVID, they produce droplets that contain the virus. And those droplets are produced whenever you cough or talk, sneeze, sing, you're producing these infectious droplets. So if they land on your eye, your nose, or your mouth, you can become infected. Now, the other way that people become infected is that they could touch a surface that's contaminated with the virus because a droplet had gone onto the surface, touching that surface and then touching your nose, your mouth, or your eyes. What we would call auto-inoculation of the virus is another way that people do become infected. So now that we've established how people become infected, we can start to think about what PPE you would need to do this. And so what we recommend is contact precautions, which is a gown and gloves. Added to that, droplet precautions, which is a face mask. And the third thing for this particular virus is eye protection. So you could safely take care of one of these patients with gown, gloves, mask, and goggles. The one exception to that is if an aerosolizing or aerosol generating procedure is being done on the patient. Let's say we're going to put in an endotracheal tube so we can put the patient onto mechanical ventilation. In that case, you need to wear an N95 respirator or a PAPR or capper instead of a regular face mask. Now, the issue has become that we are having severe shortages of various types of personal protective equipment. And that's because a lot of this stuff is made in China. The supply chain has been disrupted because the outbreak started in China. The factories were closed down. We're not receiving product that we normally receive. And so, for us here at the University of Iowa, one of our key things is the face masks being on short supply. When I look at how many face masks we have in stock currently, we have literally hundreds upon hundreds of thousands of face masks. And at first glance, you'd look at that and you'd say, gee, that's a ton of face masks. We are really sitting pretty. But what you really have to look at is how many of those face masks you use in a typical day. And then you need to sort of extrapolate from that and say, well, in this particular outbreak, how many do we think we're going to use? And once we do that, then the question becomes, how many days is that supply going to last? There's an interesting article in the New York Times this morning about the use of face masks in New York, because one of the things that we were trying to estimate is what the demand for face masks would be in our hospital, and we said we'd like to be able to maintain 4 times normal usage for 12 weeks. We didn't really have anything to guide us, but that was what we thought seemed like a reasonable estimate. And yet, when you look at the New York Times this morning, what they're describing is hospitals that are using somewhere between 50 and 30 times their normal usage.
Whoa.
So you can see how quickly you're going to burn through the supply of face masks that you have. And the problem with face masks is we're not expecting any deliveries of these products. Now, maybe the factories will open up, maybe they'll start to be shipped to the United States, but we're going to work under the assumption that what we have is what we have, and we have to figure out how best to use that. So looking at this shortage of face masks, one of the things that we really thought about was maybe what we really should be doing is better or more utilization of face shields. And so we began to look at face shields, and they really are an attractive option. And the reason is because they're durable. They're made of, some of them are quite durable. They're made of hard plastic. They provide a lot of coverage to your face, more than a face mask actually, because they cover your eyes, your nose, your mouth. And in fact, here's one right here.
Yeah.
This is one of the models that we're using in the hospital, and you can see how far that wraps around. So this comes around almost to your ears, and it comes down below your chin. So you're really getting a lot of coverage of your face when you wear one of these face shields. So that's the great thing. The second really great thing about it is you can wash it, you can clean it, you can wipe it down in between patients, and so it's not like a face mask that once it gets wet, it doesn't work anymore. This is something that's really durable, and we can use it throughout the entire outbreak. So what we started to do was try to source these and get as many of these as we can, with a goal of having one of these for every healthcare worker in our hospital. And we're still working on that. We have enough now that we have everybody in one, but not enough for everybody to have their own. So for example, a nurse, when she signs out to the next person who's going to take her shift, she will pass the face shield to her coworker. So that's what we've been doing. Now, the interesting thing about these face shields is that if you were to try to find medical face shields, you won't find any because they're gone. But the cool thing about these is that it cuts across many different industries, and so it's a different supply chain. And these, the ones that we're using, these are sort of marketed for grinding and woodwork, welding, that kind of thing. But really, they're all essentially the same. They're all essentially a piece of clear plastic with a headpiece that keeps it on you. And you can even make these yourself.